You're watching the Meditube.com, India's first doctor-to-doctor TV.
Hair transplant is a procedure increasingly sought by many to enhance or restore their appearance and beauty. Many doctors are considering to include this service into their medical practice, but are aware of only the conventional technique called FUT. This video is meant to give an overview to the newer alternative technique, called FUE, the developments in the field of hair transplant, and also touch upon the differences in the strip technique from the FUE technique.
Whereas the benefits of FUE are patient-centric, its disadvantages are just doctor-centric. Dealing first with the benefits of the technique, FUE is a minimally invasive procedure that utilizes a large donor site limited only by the bounds of one's imagination, with the ability to harvest 1200 to 2000 grafts an hour with constant practice. It gives additional freedom to sport a short hairstyle since there is no visible linear scar, since minute scarring has been distributed over a large area. African and grey hair can be better harvested without transection using FUE since the technique is based on field rather than on site. The transection rate in FUE varies from 1% to 5% in better centers. However, the transection rate is not to be confused with the wastage rate in FUT, since in FUE the roots are still embedded in the scalp and shall live to be harvested again. In FUT, they go into the bin. With FUE, healing is faster and pain after the procedure is almost nil. Therefore, surgical downtime is much less and the client can return to work after 48 hours. Last but not the least, better quality control can be exercised since the doctor harvests all the ready-to-plant grafts. As far as pre- and post-operative preparation or adjunctive care is concerned, the client is given an exhaustive list of do's and don'ts a month before his procedure is due. This entails scalp hygiene measures, stopping topical applications, avoiding use of medications which enhance hyperemia or redness of the scalp. Post-operative care lasts for 2 weeks after the procedure. The patient is advised to follow a rigorous routine of twice-a-day care. The client must be followed up on phone intermittently for the 14 days post-procedure. Lastly, medication like tablet biotin, minoxidil and finasteride in acceptable doses is prescribed for 6 months following the procedure. To conclude, I would like to state that though a raging controversy denigrating FUE technique has spread over all 5 continents like a raging forest fire, the final arbiter shall be the happy client who will embrace FUE, since the proof of the pudding will be in the eating. Thank you.